Governor, ICD-10 has been 10 years in the making, and it finally looks like it's close to being implemented. What do you believe the implications of ICD-10 on the cash flow of providers will be?
I think, it depends upon how we do it. It always does, but, it's going to be very difficult at the beginning. Anytime you go from the status quo to something new, especially something as complex and one that's going to have 16,000, payment codes, and if you add all the diagnostic codes, it's 76,000. That's a lot to learn. But I think the uniformity of it is a step in the right direction. And the fact that Orbograph is doing such a tremendous job on the EOBs and being able to simplify them, I compliment Orbograph who's putting this on. I compliment them not only because you and I are on it, but the fact is that they're taking one of the things that is really causing tremendous amount of paperwork, and that's the explanation of benefits, the EOBs, and simplifying it, put it into an understandable and a computer-type program that people can refer to and exactly find out what's taken place. The second thing people have to understand is that the administration and the paperwork still is about somewhere between 30 to 40% of the cost of healthcare. Now, if you really want to address healthcare, let's get a handle on the administration and on the paperwork of healthcare. And that's why I believe IC10, even though it's going to be confusing, even though people don't want to go from the status quo to something new, I think the fact that it's uniform and the fact that Canada's already implemented, I think in 2000, and a lot of the other English-speaking countries have done it, America should get in and be able to do it. I just don't want to overtax the industry right now with all the rules and regulations from Obamacare. The IC10 is going to add to that confusion, but in eventuality, and the reality is that it's going to be good for the system when we become uniform, and people in California, Wisconsin, and even Philadelphia comes into the mix, Mark, and is able to understand what is going on in the payment system.